Prednisolone sodium phosphate is a man-made form of a natural substance called corticosteroid hormone, which is produced by the adrenal gland. It is used to treat a variety of conditions such as arthritis, blood problems, immune system disorders, skin and eye conditions, breathing problems, cancer, and severe allergies. It works by decreasing the immune system's response to various diseases, which helps to reduce symptoms such as pain, swelling, and allergic-type reactions. The dosage and timing of prednisolone sodium phosphate can vary depending on the condition being treated, so it's important to follow your doctor's instructions carefully. Make sure to take it at the same time each day for the best results. When taking prednisolone sodium phosphate, it's important to follow your doctor's instructions. Take it with food or milk to avoid stomach upset, and use a special measuring device to ensure the correct dose. There are different brands and forms of liquid prednisolone, so make sure to read the dosing instructions for each one. Your doctor will determine the dosage and length of treatment based on your medical condition and how you respond to the medication. You may need to take prednisolone 1 to 4 times a day, or every other day. It can be helpful to mark your calendar with reminders to stay on schedule. Do not stop taking prednisolone without consulting your doctor, as some conditions may worsen if the drug is suddenly stopped. Your doctor may need to gradually decrease your dose to prevent withdrawal symptoms like weakness, weight loss, and nausea. If you experience withdrawal symptoms, contact your doctor or pharmacist immediately. If your condition doesn't improve or gets worse, be sure to inform your doctor. Remember, it's essential to follow your doctor's guidance when taking prednisolone sodium phosphate. Some common side effects of prednisolone sodium phosphate may include nausea, heartburn, headache, dizziness, menstrual period changes, trouble sleeping, increased sweating, or acne. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risk of potential side effects. Many people who use this medication do not experience serious side effects. Since this drug weakens the immune system, it may lower your ability to fight infections, making you more susceptible to serious infections or worsening any existing infections. Be sure to contact your doctor immediately if you notice any signs of infection, such as cough, sore throat, fever, or chills. Prolonged use of this medication may also result in oral thrush or a yeast infection, so it's important to contact your doctor if you notice any white patches in your mouth or a change in vaginal discharge. In some cases, this medication may cause an increase in blood sugar levels, potentially causing or worsening diabetes. If you experience symptoms of high blood sugar, such as increased thirst or urination, notify your doctor immediately. If you already have diabetes, be sure to regularly check your blood sugar levels as directed and share the results with your doctor, as they may need to make adjustments to your diabetes medication, exercise program, or diet. It's important to inform your doctor right away if you experience any serious side effects, such as unusual tiredness, swelling in the ankles or feet, unusual weight gain, vision problems, easy bruising or bleeding, a puffy face, unusual hair growth, changes in mental or mood, muscle weakness or pain, thinning skin, slow wound healing, bone pain, or symptoms of stomach or intestinal bleeding. If you experience chest pain or seizures, seek medical help immediately. Although rare, a serious allergic reaction to this drug is possible. Contact medical help immediately if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects. If you experience any other effects not listed, be sure to contact your doctor or pharmacist promptly. Before taking prednisolone, it's important to talk to your doctor or pharmacist if you have any allergies, as this medication may contain inactive ingredients that could cause allergic reactions. Additionally, make sure to inform your doctor about your medical history, especially if you have any eye disease, heart problems, high blood pressure, liver or kidney disease, diabetes, or any mental/mood conditions. It's important to note that this medication may make you dizzy, so it's advised to avoid alcohol and marijuana. Also, using this medicine may increase the risk of stomach bleeding, especially with daily alcohol use. Before undergoing surgery or dental procedures, be sure to inform your doctor about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Prednisolone may also contain alcohol, sugar, and/or aspartame, so it's important to use caution if you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet. Using corticosteroid medications for a long time can make it more difficult for your body to respond to physical stress, so it's important to inform your doctor before any surgery, emergency treatment, or if you get a serious illness/injury. This medication may also mask signs of infection, making it easier for you to get infections or making current infections worse. It's important to stay away from anyone who has an infection that may easily spread and to talk to your doctor if you have been exposed to an infection. Before having any immunizations/vaccinations, it's important to inform your healthcare professional that you are using prednisolone and to avoid contact with people who have recently received live vaccines. It's important to note that this medication may slow down a child's growth if used for a long time, so it's important to consult the doctor or pharmacist for more details and to see the doctor regularly so your child's height and growth can be checked. For older adults, it's important to be aware that they may be more sensitive to the effects of this drug, especially bone loss/pain, stomach/intestinal bleeding, and mental/mood changes. During pregnancy, prednisolone should only be used when clearly needed, as it may rarely harm an unborn baby. It's important to discuss the risks and benefits with your doctor. And if you're breastfeeding, it's important to consult your doctor before doing so. When taking prednisolone sodium phosphate, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include aldesleukin, other drugs that weaken the immune system, mifepristone, and drugs that can cause bleeding/bruising. Additionally, other medications can affect the removal of prednisolone from your body, which may affect how prednisolone works. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless your doctor instructs you otherwise. This medication may also interfere with certain lab tests, so it's important to inform lab personnel and all your doctors that you are using this drug. If someone has taken too much prednisolone sodium phosphate and has severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share this medication with others. If you're using this medication for a long time, your doctor may recommend lab and/or medical tests to monitor your health. These tests can include checking your blood sugar and mineral levels, blood counts, blood pressure, bone density, eye exams, and height/weight measurements. It's important to keep all your medical and lab appointments. Talk to your doctor for more information. Using this medication for an extended period may lead to bone problems such as osteoporosis. To reduce the risk of bone problems, your doctor may suggest lifestyle changes like doing weight-bearing exercises, getting enough calcium and vitamin D, quitting smoking, and limiting alcohol. Talk to your doctor about lifestyle changes that could benefit you. If you are prescribed prednisolone sodium phosphate to be taken once daily, and you happen to miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, then just skip the missed dose and take your next dose at the regular time. If you are instructed to take this medication every other day, it's best to consult your doctor or pharmacist on what to do if you miss a dose. When storing prednisolone sodium phosphate, make sure to follow the instructions on the product package. Some brands need to be kept in the refrigerator, while others can be stored at room temperature. It's important to keep this medication away from light and moisture, and do not store it in the bathroom. Always keep it out of reach of children and pets. If you no longer need the medication or it has expired, make sure to dispose of it properly. Do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. You can consult your pharmacist or local waste disposal company for the best way to discard it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.